So those who are new here, I'm Dr. Pradeep. I am MD Pharmacologist, and I make a lot of videos about research, about PG life, about tools, about guidance, tutorials. I'm also very active on my Instagram, so if you want to check that, you can check that too. Now, when it comes to practicals, there are sections in which is divided, that is written section and Viva section. Okay. So before starting, I want to clear a point that this whatever I'm taking, whatever the structure, it can be different from college to college. So just confirm with your seniors or previous batches and how your exam is structured. So I'm going to give you just the basic points or some essential tips that you need to go through these practicals. Okay. Let's just discuss writing part first, because there are not much tips when it comes to writing part. This is something you read, you gain their skills over time, and even if you want me to discuss some topic regarding that, you can always mention that in the comment section and I can go through it. Okay, I forgot to mention that there are 3 parts. That is, first is writing part, then there will be Viva part, and there will presentation. Presentation, like you will present things and people will ask, or the examiners will ask questions regarding that. Okay, so first we'll discuss about the writing part so that we can keep that aside, because mostly the tips will be related to the Viva and all that. Okay, so when it comes to writing part, this can be different when it comes to college. The structure can be different, so you already refer back. So when it comes to writing part, you will have a protocol writing, you will have prescription writing and criticism, you will have PK/PD calculation. There is some questions will be given relating to the pharmacodynamics or pharmacokinetics that you will have to solve. Then there is DPL, that is drug promotional literature, which you'll have to criticize. Then there is ADR form, you'll be given a problem and ADR case, and that you have to fill in that ADR form. That will be there for writing part. That covers all your writing part. It will be obviously taught to you during your residentship, so that should be clear. When it comes to Viva, we have instruments, we have dosage forms, we have CAD, BP, we have bioassays, that is matching and interpolation, that is basically finding out concentration of the organic solution. There will be unknown and there will be known. We'll compare it and we'll find the concentration of unknown solution. And there is rabbit eye also. When it comes to CAD, BP, nowadays the CAD, BP experimentation are not there. It will be mostly given the charts and you'll have to identify, and then you'll have the Viva on that. Okay. There is also rabbit eye experiment. This is also depends on your college. If they are doing the rabbit experiment, that is rabbit eye experiment, then have to see. Otherwise, sometimes we are giving a chart only to identify which drug has been applied to the rabbit eye. It is rabbit eye experiments. If you want more explanation regarding the rabbit eye and how to identify which drug has been given, do let me know in the comment section. I will make a thorough video about that. And other tip I can also give you, just see Govindrai Garg's video regarding rabbit eye experiment. He has made it very easy, so it can be very helpful for you. You will not forget that. Okay, so Viva will be on CAD BP, that is actually given chart, so CAD BP. Then on the rabbit eye experiments, that is depends on your college whether they do it or it's just the charts given to you. Then there is bioassay, this interpolation and matching methods. There are 2 methods that you have to do and find the concentration of unknown solution. That will be this bioassay and all will be taught to you by your teachers. We have also one section of animal handling where you will be given animals and you have to demonstrate the feeding or intraperitoneal injection and that. So that part will also be there. If your college has animal lab, you will be obviously given that training to handle the animal and how to give peritoneal injection. If you don't know, do let me know in the comment section. I'll definitely make a video regarding how to comfortably handle or how to easily handle the animals and intraperitoneal injection. Okay, keep that in mind. We are done with the Viva part. When it comes to instrument, remember there will be organ part. And there will be a lot of experimental thing that will be asked to you. One will be dosage forms, right? Oral, parenteral, that. So that is a different part when it comes to instrument. That is the dosage form. And when it comes to instrument and animal handling, I'll suggest you need to have 2 books or at least the PDFs. That is Ghosh and Vikash Mehdi. These are 2 main go-to book for you for the practical exams. Okay, so Vikash Mehdi and Ghosh. I'll briefly tell you what are the things that are important that you need to read from these books. There will be organ bath. Organ bath will be kept and you will have to briefly explain what parts it has, whom it was discovered by. All this information you will get in Ghosh. Okay, you can go through it. Next will be type of levers. Okay, there are different type of levers used in that the chemograph. So you will have different type of levers. So that can be a question. What are the different type of levers? Nicely given in Ghosh and Mehdi both, but I'll advise you to go through both of that from both of the books. Just read whichever you find easier. You keep that in mind, but in both of them it is given nicely. So we are done with the levers. We also asked about organ bath solutions that are used, and in what organ tissues which solution is used. Okay, that is nicely given in Mehdi. We'll also need to read about different type of laboratory animals that are available in detail and what are their which type of experiments they are used. It will be the initial part of Ghosh. You can read that all the animals are given, that is rat or mice, rabbit, guinea pig, all that is given. So when it comes to these animals, which tissues are used and for what experiments, this is the part that you have to remember. And also type of that animal and their weight. Okay, alternatives to animal experimentation, and also the regulatory authorities that are involved in animal experimentation or the safety of the animals. Okay, so basically I have told you about animal experimentation instruments, what are the important things in that. And now what is remaining is pedagogy, that is you have to give a lecture to the examiners for maybe 5 minutes depending on your college decides. Then there are presentation, there is journal presentation. If you always present a journal presentation in your PG program, if you haven't, cool, let me know. I'll give you how, I'll make a video regarding how to make a journal presentation. Then there is grind over, that is obviously subjective, depends on that, you can't really explain. So when it comes to pedagogy, just pick a simple topic or simple portion of a topic. For example, if you take beta blockers, just take one drug out of it and explain, or just explain one concept, that is maybe mechanism of action of a beta blocker, the uses of beta blocker. Don't take the whole point. Okay, don't take the whole portion, just take a small portion which you can easily explain in 5 minutes. And the timing is very important, you have to finish it in that timing. And depends on your college, that some of the examiners like them being treated as students, like you have to ask them questions, you have to make them quiet. If they talk amongst themselves, you just pretend that you are a teacher and they're students. That is how you have to do your pedagogy. That's some of the examiners are very particular when it comes to that. Okay, so that you have to remember when it comes to pedagogy. Now when it comes to journal presentation, there are different guidelines to criticize. There are different for randomized controlled trial, there are different for observation studies, so you have to criticize the journal accordingly. Okay, so there are strobe guidelines and there are other guidelines for even observational studies. So you have to see, that is the most important part, that you criticize the journal according to the type of study. Different type for randomized controlled trials or interventional studies, and different for observational studies. Okay, that you have to remember when it comes to journal presentation. Whenever you are presenting, keep the slides short and precise, just keep few important points and maybe 10 slides or 7-8 slides and finish it fast. Okay, because the more stuff you put on the slide, the more examiner get a chance to ask you questions. So just put the important findings about which you are very confident and you can answer. Okay, so that is the thing you have to remember when it comes to presentation. And also, if any of these topics which I mentioned you are not able to understand, do let me know if you want me to make a video regarding that. And with that, I think I have covered almost all the important parts, and I hope it helps for your Viva, and I wish you all the best. Other important thing is sleep well before your Viva, eat well, have your breakfast, go there, just be calm, don't overthink, use your presence of mind, don't be in a hurry or don't be in a rush to answer the questions. You will get through it. If I have, you should too. Okay, so with that, I'll see you in next video. Till then,